Hi, everyone. This is Dr. Hugh Cole. I'm a certified professional hypnotist, and I'm here with my friend Hypnojade. Hypnojade has just had an amazing experience that we want to talk to you about. She's actually had an eye operation completely under hypnosis. Those of you who have been following our stories know that Jade and I are, I believe, very much in hypnosis. And she's just had an eye operation under hypnosis, and here she is a few hours later, home, to tell us all about it, and what happened when she went in there. So, Jade, tell us what happened, okay? You seem excited, so tell us about it.
Well, yeah, it was really great. This was my second eye surgery. I had, just to let you know, I've worn glasses ever since I was a child, and I got a form of cataract that happens when your eyes are just really have poor vision. So I had my left one done here last week without anesthesia, and then I just had this one done today without anesthesia. And the interesting thing about this is that it was done at two different hospitals, and the hospital that had this one done today refused surgery twice because I wasn't going to take anesthesia. So finally the doctor had to intervene and say, yes, she can really do this. So they were absolutely amazed. It was absolutely hysterical. I come in, I had my little heels on, and had took my jewelry off, but I was very alert, and I said, I'm not getting anesthesia. I had to keep saying that. And the anesthesiologist came in. She was a wonderful woman, and she said, would you just like a little fentanyl? And I said, no, thank you. And so then when I got into the operating room, she asked me one more time, would you just like to have a little propanol? I said, no, I really can do this with hypnosis. So we went through the surgery, and I did have eye drops. They make them nummy, but I did have that, and I was relaxed during the entire time, and it was cute because they would say, we're here for you. And the doctor only asked me one time if I was okay. The first time he asked me about 3 different times, but he already knew I could do it. So I come out, and she tells the nurses that I did this with hypnosis, and that I didn't have any anesthesia, and that my blood pressure stayed and maintained 99/66.
Amazing.
My blood pressure.
Absolutely amazing, yes.
It is amazing because that is my normal blood pressure. And she said it never wavered one way or another. It stayed and maintained it, and I think that's an incredible testimony. So the funny part is my friend and I are sitting there, we're talking, we're joking around. The nurse's mouth is like dropped open. She cannot believe it. And, people are walking, nurses are peeking around the corner at the, through the curtain, wondering what's going on here because everybody is sedated. I get up to go to the bathroom, and of course I don't need any help. And,
Amazing.
No, thank you. So it's just hysterical. I had such a great time, and it was really not a big deal, but it was a big deal. You know what I'm saying? I mean, Dr. Cole is my personal hypnotist. We're both hypnotists, but he's my personal one. And so he hypnotized me the night before. And also, I know how to do self-hypnosis. So as I'm laying there, I just breathe and relax and let go.
Yeah.
So there was something I forgot to tell you, Dr. Cole, is there's one of the things that doctors and nurses say in the operating room say some really strange things. And the one thing you don't want to hear is oops. And so I think I asked you to help me with that so that if anything happened, if I heard oops, I'd be okay. Well, I forgot to tell you with this eye, the doctor did say oops. And that's just because your eyes are open the entire time. So as a scalpel is coming down to my left eye, he goes oops. And somebody had hit the gurney and caused it to shake. So we're shaking here, and it didn't even bother me. And so he goes, are we ready now? And so then he started doing the cutting. So my eyes are open. I'm seeing the scalpel come to make the cut. And it was just absolutely phenomenal. It was great, and it felt really good to just jump off the table and go out and have sushi with my girlfriend and watch a stupid television program that she likes. And then I drove myself home. So it was great.
Absolutely amazing. Yeah, a little bird also told me that you wore your high heels out of the operating room, that you actually got...
I actually did. Yeah, right out of the post-op. I put my heels back on and went out. They were just amazed. I mean, it was so hysterical to see people. I didn't just see people with their mouths actually dropped open, because everybody is so sedated. And the reason why they do that is, they sedate people to make them physically comfortable, so they're controllable, so they're not going to do anything like thrash around. But that's why they have to put on the heart monitors, and they put oxygen on and an IV, because the medication that they give you for anesthesia does cause problems. It can result in death, and cause just really a lot of problems. And I didn't want to do any of that. And my health is very important to me, as it is to other people. But with hypnosis, it's really important for anyone. There are people who are high risk for surgeries. They have heart problems, or they're just high risk for some reason. And hypnosis is a very safe and healthy, helpful way to go through any kind of surgical procedures.
Yeah, healthy, helpful hypnosis.
Healthy, absolutely. You got it.
Yes. Well, this is doubly amazing, because the thing that you've completely left out is that the morning of the operation, you had an attack of bowel syndrome. And you called me up.
I did.
Yes,
I did.
I was in the middle of something, so I said I can give you a couple of minutes. And we did a hypnosis session in the morning for your little IBS attack. And poof, it was gone. It was so far gone that you even forgot to mention it here. So hypnosis is
I did.
Thing. Yes. Okay.
Yeah, so what happened is I found that I had some dairy. And I didn't I thought I could get away with it, and I didn't. And I had a really bad attack. I had a lot of physical pain and gas, and it was coming up into my heart and stuff. And it was like, oh my God, just before surgery. So I did call you, that's right, before, and ask it just to help me to relax and to minimize the symptoms of that. And that actually, I didn't even remember that when I was fine by the time I got to the surgery center. I was absolutely fine.
You're an amazing lady, and it's really a pleasure to work with you. For those that don't know Jade's whole story, she's not been really able to see color for quite some time, and we're very excited because we're going to be able to see color in about 30 days. That's what they're saying. Her vision's going to be perfect. So, as a reward for all of this, and those of you who are following our blog, our kind of video blog here, in about 30 days, Jade and I are going to Las Vegas, where I'm going to be a seminar and having lots and lots of fun. And I'm going to do another video blog where she's going to be reacting to the lights and the mystery of Las Vegas. It will be.
Oh gosh.
Yeah. And
I got chills. Yeah.
This could be a fun situation, but hypnosis is a wonderful way to maintain and take care of your health. There are a lot of things that you can do with hypnosis that people don't really even understand how powerful and how good hypnosis can be as a medical tool for healing. It's been my pleasure to do this interview. Right now, anything else you want to say, Jade, before I sign off and say goodbye to our friends?
No, life is good. Life is good. Thank God for hypnosis, and I'm really glad that we're friends. I'm looking forward to going to Las Vegas and doing some hypnosis out there with you too. So, thanks.
Wonderful. It's going to be a fun time. Okay. All right. Well, Thanks everybody for tuning in. Any questions?
Bye, y'all.
Put them down there in the little box, and Jade and I will answer them. Maybe I'll put a link to her blog so that you can talk directly to her. We'll see
and I'm
how
on Facebook too.
Yeah. Yep.
I'm on Facebook, Hypnojade.
Hypnojade on Facebook. Look her up on Facebook.
Mm-hmm.
And we'll talk to all of you later. Bye-bye now.
Bye. Kiss.